So thank you very much, Mr. Mesut. This has been a great introduction by you for me. Thank you very much, and good morning to you all. And we will be talking about what we know, and we will be talking about the new treatment approaches, and we will be tackling it from the perspective of antipsychotics. Actually, in the diseases which relate to other diseases, the environmental factors, the lifestyle, genetics, and molecular level changes and structural changes, including all these, there are many factors. They have a role in this complex disease. And we know that from the very old time, the pregnancy duration, and which starts with the childhood trauma, the microglia cells with the activation of this, the reactive oxygen radicals increase, and then inflammation markers levels increase. And in the recent times, the receptors, NLP pathways, and within the cell, the signaling pathway, they cause the DNA changes. And this problem comes out to be of these problems. And hallucinations, delusions, catatonia, these are all traumatic problems of this disease. And from the very old time, so dopamine receptor is available. So for that reason, our treatment approaches actually are about the blockage of the receptors. And as we know that the stratinium is also a dopamine pathway, and in schizophrenia is affected by this dopamine. So we know that the motor dysfunctions and other side effects can also appear, can emerge. And now, because of this, actually, the dopamine has a main role, and frontal cortex dopamine reduces, and negative symptoms is caused because of this. And mesolimbic pathway, we see that there's a reduction. And when we look into the other symptoms, serotonergic system modulation, and also serotonergic and dopaminergic balance disorders are present, and we have to look into the resource of this. And for years, GABAergic systems, and we see that there's a reduction, and in the back, glucomagic NMR receptors hypo functions were questioned. Sorar mısın? So with the synaptic plus neuropathic have got role, and then there are structural changes, and if this is a disadvantage added on top of it, so we see that the success is not achieved and the relapses occur. And just we're talking about schizophrenia in this regard. And of course, it is a typical or atypical antipsychotic. So the typical antipsychotics or atypical antipsychotics, serotonergic dopamine blockage is done. So indirect modulation, atypical antipsychotics. So this is also another problem of the efficacy. So there are weeks required to have it. And as we know that they have severe side effects and severe side effects. And for this reason, we need to stop, and we have to finalize the problems of the patients accordingly. The side effects are to be stopped, and they are done with the new approaches. And I will try to summarize this. So for that reason, in treatment of schizophrenia treatment, whether this is neo, dopamine, two receptors. So this hypothesis, what we're used to, whether this will be staying on the shelf, we will be questioning this. As you know, the second generation, the newest members are actually, we see this table here, lorazepam, brexpiprazole, and cariprazine. They go through the dopamine and lumateperone actually started to be used on the other system. So D1 receptors and AMPA receptors, they are included in this system. And once again, olanzapine, samidorphan is added, and actually this opioidergic system is new for this. And just additionally to this dopaminergic system, with this dopaminergic system, between the cholinergic system, there is also imbalance, and we have to take into consideration this. And this is a new age, and many of the new drugs, they go through the cholinergic system. And the cholinergic system, the muscarinic systems, M1 or M4 receptors, they have an agonistic effect. So for that reason, and they are the candidates to treat the disease. And I would like to make a reminding, M1 receptors, they are rather located postsynaptically in the frontal cortex and the hippocampus. And these receptors, through these receptors, cholinergic can be acetylcholine could be released and supported, and as a result, as an output, and the cognitive functions can be recepted. And M4 receptors are rather presynaptic autoreceptors, and their main task is they inhibit the acetylcholine release from the hindbrain, and accordingly, with the inhibition, these with the application of the agonists, ventral tegmental area and the brain are affected, and with this projected in the striatum, dopamine is released. And with this reminding, I would like to look into the candidate drugs, nomaline, especially is a preferential M1 and M4 agonist, but they also affect in the periphery. They do blockage, and the cholinergic effects are prominent. In order to hinder this, it is accepted that they do not exit the brain-blood barrier, and accordingly, cloxinoprane is used, and accordingly, there is a total blockage that has been achieved. And the clinical studies are within the phase 2 studies in 182 patients. Twice daily, 30 milligram of the agent is given, and in this study, in 5 weeks, statistically, there is an important significance, and the side effects, as regards the usage of the nomaline usage, the side effects are less. And when we look into the phase 3, there are similar molecules going to the phase 3, and here we have the just independent of the D2 receptors, through the M1 and M4 receptors, good results are achieved, and accordingly, currently there is this tolerability and safety studies are ongoing. And another molecules, emraclidine, and this is a selective molecule, allosteric modulation. You know that there is a change in the receptor. So for that reason, with lower adjustments are to be done. There are 2 studies about this. One of them is 5 to 40 milligram per day is given, and the other one is in the psychosis, the first attack, acute schizophrenia, it's 20 to 30 milligram per day, and they are used accordingly. and positive and negative symptoms. What of the doses are effective on negative and positive doses as a result of 6 weeks work. And what is good about is that generally all symptoms are improving, and there are mild side effects, just like headache, for example, and just small increases in the hypertension, and this is not statistically significant. And also in terms of weight gain, there's not much effect. So for that reason, this is really promising. And once again, with the similar molecules for 52 weeks, there are studies which are lasting for 52 weeks in terms of safety and tolerability. And these long-term studies, will be finalized in November and June, if everything is in shape, of course. And another molecule is M4 agonist. It is very selective, and it hasn't got a name yet. NBI 1117568. It is named likewise. It is in the phase 2, and in terms of efficacy and safety, tolerability studies are ongoing. And at the end of this year, it is expected that these studies to be accomplished. And now there is a different mechanism that I would like to mention, and transamine receptors. This is a molecule. Transamines, as you know, that they are mediators within the cell, and the receptors within the cells are also present. And uloteron blocks these receptors. So for that reason, even it affects through 5-HT1A receptors partially. So not only it modulated by dopamine, serotonin and noradrenaline can also be modulated with this. Within this framework, the studies are within phase 2 in 245 patients in 4 weeks. Actually, the gastrointestinal effects are rather prominent, and despite that this is a completely different mechanism, it does not cause dopamine 2 receptors. This is how it is. So for that reason, these are actually mechanisms that really disturb the what we are used to. So I think that this is what you are familiar with. This is eclairpartine. This is selective inhibitor of glycine transporter 1. You know that glycine, it's a transmitter, but glutamatergic MDA receptors it is binded to the binding part, and accordingly it potentializes the glutamatergic potential. It's a co-transmitter of the glutamatergic system. Glycine acts like this, so it hinders the binding to the receptors, and accordingly NMDA receptor hypofunction is supported. And also, so far, what has been found so far with its hippocampal effects, we see that there's a suppression is caused. And eclairpartine is within the phase 2 study, and with the current, additional to the current antipsychotics, within 12 weeks, 10 milligram, 25 milligram per day is given, and the cognition effects are found to be significant. Of course, we have to remind bitopertin here, because in this mechanism, important investments have been done in the past, and afterwards we couldn't use it. So eclairpartine, how much promise is important. We have to think about this. And another molecule is pimavanserin, and this is an inverse agonist, and it is affecting on serotonin in two ways, 5-H2A and 5-H2C. This is the molecule that you know because FDA has approved this for Parkinson's disease. So for that reason, it closes the serotonin receptors and it prevents 5-HT binding to receptors, and it may elevate psychotic symptoms without impairing motor performance. And there's an hypothesis that it improves the situation. And it is within phase 3 and for 396 individuals. 20 milligrams per day is given, and when it is given with 6 weeks, there's a tendency improvement. However, this is not significant statistically. So upon this, the study was prolonged to 26 weeks with a bigger group, and this time, especially negative symptoms, it was found to be having suppressive effect. If I to summarize it, classic dopaminergic and additional serotonergic pathways, new from the perspective of new pathways, we have glutamatergic pathways and muscarinic receptors and transaminase receptors are involved. And here, these through the dopaminergic pathways with the restriction of this, we see that the physiology of the schizophrenia with the and all these neurotransmitter with modulator roles of the transmitters, and we see that this will be evaluated accordingly. And I will be talking about the typical and atypical antipsychotics. And you know, M1 and M4 agonists are to be seen prominent, and we see that then TAR1 antagonist and glycine transporter, how useful it will be, we will set an inverse agonist on the serotonin receptors. And I hope that we will be benefiting from this. Thank you very much.